Dr. Prickett.
And I am Dr. Pancratz. And welcome to Stacy's Kidney.
Hi, I'm Dr. Boone-Perm, and I'm going to be teaching you about the kidneys. The kidneys are located at the back of the abdomen, underneath the ribcage, and are about the size of a fist, so they're 4 to 5 inches long. The kidneys are shaped like kidney beans. Each kidney is surrounded by a renal capsule, which helps protect it from any trauma and damage. The kidneys are contained in the area between the back and the peritoneal area, which is known as the retroperitoneal. The retroperitoneal space also contains the vena cava, the pancreas, and the aorta. The lower two thoracic vertebrae, T11 and T12, protect the kidneys. The renal artery empties blood into the kidney at the level of the first lumbar vertebrae. The kidneys are surrounded by perineal fat, which protects the kidneys. The kidneys are anchored into place by the renal fascia. The renal fascia is composed of connective tissue, which encapsulates the kidneys.
First, let's talk about Stacy's external kidney. This is the outer part of Stacy's kidney, known as the renal capsule. You can see here the inside of Stacy's kidney, which is very small. Some of the structures that can be seen on the outer part of the kidney is the renal vein, which is the blue dye, and the renal vein carries blood that's been purified by the kidney to the inferior vena cava in the heart. The renal artery, which is the red dye, supplies the kidney with blood from the heart. The renal pelvis acts as a funnel for urine flowing to the ureter, and the ureter then carries blood to the bladder.
Next, we will be examining the inner structure of Stacy's kidney. Here is an example of the inner structure of Stacy's kidney. You may remark at first these large colored segments of the kidney. These segments are known as the renal pyramids. The renal pyramids are organized tissues of medulla. The medullary tissues in kidneys are composed of the loops of Henle's, which are found in the nephrons of the kidneys. The loops of Henle's are tubules with an ascending and descending limb, one of which pumps out water and the other of which pumps out ions. Outside of the medullary tissues, you will find the cortex of the kidney. The cortex involves the glomerulus, the Bowman's capsule, the proximal tubule, and the distal tubule of the nephron. In addition to the medulla and the cortex, you will find the renal papilla or papilla at the base of each pyramid. The papilla at the base of each pyramid collects the urine and the fluids, which in turn are conducted into the minor calyxes. The minor calyxes in turn form the major calyxes, which later conduct the fluid into the renal pelvis. The renal pelvis then, which is an enlarged tube, allows the urine to flow into the ureter, and there is one ureter per kidney, thus 2 ureters will go down into the bladder for release. Furthermore, along with the kidney, one will find the hilum, which are the folds encircling the veins and the arteries which enter and exit the kidney. In addition, in between the renal pyramids are segments of tissue known as the renal columns. Thank you.
Let's talk about the link between kidneys and other things. Amino acid supplements and high-protein diets can cause kidney stress and damage to the kidneys. This is due to excess urea production that the kidneys have to work harder to excrete. High-protein intake can also acidify the blood. Dietary protein intake can modulate renal function and has a role in renal disease. Salt and excess fluid may build up in the body if the kidneys are not working correctly. This can lead to high blood pressure and sometimes kidney disease, which can eventually lead to kidney failure. Kidneys also work with the body to prevent acid-base imbalance. The kidney's role is to remove nitrogenous wastes from the blood while conserving proteins and water. Removing the nitrogenous wastes keeps blood pH levels in the normal range. Some types of kidney stones can be formed if the urine is persistently acidic. One of these kinds of stones is called uric acid stones.
Hello! Next we will be discussing anorexia nervosa. Anorexia nervosa is an affliction which causes the sufferer to believe him or herself to be overweight when other indices such as the body mass index indicate that they are not in fact overweight, but rather underweight or normal. There are two main types of anorexia nervosa. The first type of anorexia nervosa is the restricted eating type, in which the sufferer tries to limit the amount of food consumed in order to reduce the amount they think of body weight. And the binge eating type of bulimia, which should not be confused of anorexia, which should not be confused with bulimia, which is defined by another set of standards. Now there are many implications of having anorexia nervosa and many implications of that on the kidneys. For example, some generalized afflictions include kidney stones and kidney failure. However, there are two examples of severe repercussions of anorexia nervosa. One of these repercussions include the affliction known as hypokalemia. Hypokalemia occurs when there is a lack of potassium within the bodily system. This lack of potassium usually occurs with the binge eating type of anorexia nervosa. For one afflicted with the binge eating type, as we may have mentioned, that the sufferer will consume much food but will then purge their body through vomiting or laxatives. Through this purging, the sufferer will lose much sodium in the process, and the body will then go into hypokalemia, and that condition will be maintained, and through that condition of hypokalemia, the body will start producing amounts of ammonium, which is detrimental to the body. Another example of a severe affliction associated with the binge eating type of anorexia nervosa is known as hyponatremia. Hyponatremia occurs due to a lack of sodium in the body, which is associated with large water intake. Many anorexics may consume excessive amounts of water, either in belief of the cleansing and purifying effects of water, or to satiate their hunger with water. An implication of this is that as excessive amounts of water enter the bodily system, there is less of a quantity of sodium and chlorine, which has further implications, meaning that the nephron and the glomerular systems in the kidneys will wear away, and furthermore, the medullary tissue in the kidney will form cysts.
Go.
Me.
That was so dumb.
First, let's talk about Stacy's external kidney. This is the outer part of Casey? Stacy, sorry. Casey.
Kidneys are surrounded by perennial fat. Perennial? They are not plants.
Just go on. You should have just gone on.
Okay, start at perennial fat.
Okay.
Or
You
the-
can just cut this out.
Yeah.
Good.
This is due to excess shoot, how do you say that word?
Urea.
Okay. So.
Another type of anorexic nervosic is the binge eating category. Not to be confused with anorexia bulimia, which is categorized by a different set of standards.
Hi, I'm Dr. Boone-Herm, and I'm going to tell you about the kidneys. Okay, so the kidneys are located at the back of the abdomen.
Okay, I'm sorry.
Wait, you have to explain bulimia again, because that's going to get cut out because
Okay.
you're laughing.
You look to the side, and I was wondering what you were doing.
You
No,
started
no.
laughing again.
No, you turned your head, and I'm like, what? And then, okay, let's start by vomiting. Okay.
Let's talk about kidneys and their links to other things. Amino acid supplements and high-protein diets can cause kidney stress.
Kidney
Do you want to restart?